children or up to 8 related children. And the individual has to be 18 years of age, or if they're under 18, meet requirement for employment of minors. A relative is okay, except when they are the legally responsible caretaker or parent. So it could be a grandparent, aunt, uncle, and again, you have to go through the application process to become a provider in
Now,
that area.
I'm just looking at the Child Care Council news link here. So the child care programs, is that the number of providers that you have? Because there's daycares, it looks like 8, 9, 10, 11, and then family daycare, there's a breakdown, right?
Mhm.
That's the total number?
I believe so, I don't know what you're looking at.
Yeah, I was
I'm not
just,
sure.
because there's a breakdown of daycare
Yeah.
centers, family daycare, group family, and
Those are
School
probably
age.
the different types, so then that would be the total amount.
Okay. Those are
So the types are legally exempt, and then you have family daycare provider, and they're registered, group family daycare, daycare centers, school-age childcare, legally exempt group childcare, pre-K nurseries, summer day camps, and daycare centers that are on federal properties, tribal properties, that's another category. So those are all the categories of provider that are possible.
so it doesn't look like there's a whole lot of providers, so there's an adequate number, because they probably have a limit, right, of how many children they can take?
Each one of them has their own, category of how many children they can have, and whether or not you would need an assistant, depending on the age of the child. If you have children under 2, there's certain requirements, you need to have more staff in different ratios.
It is
I-
very highly regulated. I used to be the vice president
It
of
didn't
Child Care
always,
Council.
it wasn't
and-
always, yeah.
And it's, in order for you to be a certified child care provider, you have to comply with many of the rules of the Department of Health with regard to square footage and the number of children there, and there are some other stricter rules for infant care. The Child Care Council has been very good at trying to get people certified and compliant in those purposes, but a majority of the daycare is provided still, and it's not just in Sullivan County, by informal daycare providers.
And that's these.
Those are some of those are informal.
Cindy, can I ask a question?
Mhm.
So, need a little bit more clarification on this 30 days to process, Giselle, because we had an incident earlier this year, if you recall, Randy and Josh. I'd gotten a letter from a daycare provider in my district who was having trouble getting paid on time, and it just seemed like the more she tried, the more entangled she got. And at one point, I asked the Child Care Council, how long does it take them to process on their end?
Was that the same
Is that a
one that was
claim?
arrested?
No, no.
Because there was one that was arrested that was complaining about not receiving checks on time.
Right,
See
no,
what?
this person was, I went to visit their daycare center, and they were bona fide.
Is it around the same time that it was?
Okay.
But they also had, a bona fide daycare center for people who weren't on public assistance, so they had full paying children plus children from families, so
So
at that.
imagine in the process, okay, someone comes in today to make application for temporary assistance, right? There's-
In other words, I'm coming in
You're
to
coming in
ask for
today,
daycare.
you're
Okay.
applying for temporary assistance. We have 45 days to process that application.
Mhm.
Meanwhile, life is occurring, you have small children, you need daycare because you're doing job search, so on and so forth.
Okay.
Okay? What we've had conversations with the council and providers about is that we cannot authorize that
Mhm.
child care because we don't know if they're going to be eligible for assistance.
Mhm.
So what happens often is the providers assume risk
Mhm.
and accept that child into their program.
Mhm.
So if that applicant, for whatever reason, is not eligible,
Mhm.
we didn't authorize it, so there's not going to be reimbursement.
Mhm. So
Okay,
they,
so-
they know that when they're taking them on, that there's that.
know,
risk.
I-
Be authorized.
They know it,
Okay.
and Don Willie has talked to them about it,
Right,
but they still do it. I mean,
Okay.
it's a pretty competitive industry, the daycare, the childcare, and you know,
Mhm.
they accept children, and it's purely on risk. So then if the informal childcare, I think we may have been working with where a family member a grandmother
That
or
wasn't the
grandfather.
situation, but
That
what
was
I'm
the
trying to
think
get
we
at
do have
was
to move
what
along.
happened.
Yeah.
Okay, I can ask this question offline, it's just in terms of, the question we asked was that the Child Care Council said that they would be willing to help process these invoices, and then there was an issue about whether that would
I mean, right now,
upset the
there's a check and
unions.
balance that that the provider, and providers can do their timesheets electronically. Our providers do not do them electronically for the most part, they do hard copies, so you can imagine, by the time they give their hard copy to Donna, Donna's person comes in, she's a part-time person, she signs off on them, then it's a check and balance, it goes to DFS, to the child care unit, DFS then reviews it, has to enter it in, and then the payment is issued.
So
through the
bottom line,
local
is it
process.
smoother now than it was before, or is it still
I
going?
believe it's much smoother than
Okay.
it was, and the payments are much more contemporaneous, but you always have that risk in the front end when providers continue to take kids without that approval from us that the applicant is eligible.
For new ones, for new children,
for new
okay.
new
That's
applicants.
helpful, I won't ask any more.
Okay, I'd like to move on, in the interest of time. The discussion monitoring of the safety net program. I know safety net carries a high county share, 7120.
71%.
Right, and we had discussions about, better monitoring that, so could you kind of fill us in on that?
I mean, Giselle, we'll talk about, a couple different programmatic things, but the 71% is for the safety net population. Most of the safety net population are single individuals who are eligible to work. So when you have a single individual who's eligible to work, who comes in and needs assistance, they're in that safety net mode of reimbursement, where it's a high percentage of 71% county reimbursement. Now, we had hundreds of individuals in motels who were homeless, and most of those were safety net. We now have that number, I believe it's 26 individuals and 16 families who are now in area motels. What we've done with that is, and Giselle has, individual information, anecdotal, more transitional housing. We established the agreement with the boarding room in Monticello. And then the fraud unit is doing random inspections of motels. Are you there? Who's supposed to be there? So on and so forth. Are you, and that, meeting the requirements. The other part is the integration with the workforce requirements, with the employment requirements. We just submitted our updated employment plan to the state, and they're in the process of reviewing it. We had a state site visit. They went to the orientation program with CWD. They gave us some recommendations in terms of, fine tuning some things in the program. The other area in the safety net where we're looking at is the substance abuse population, and we see a pretty significant number in what's called congregate care level 2. And that's pretty expensive on a monthly basis. And, we'll continue to talk with Joe Todoro about that and getting folks in and out of that congregate care level 2. So it's kind of a multifaceted look at it, focus on it, and how other families become in the safety net program are the individuals who have been on temporary assistance for more than 5 years. And, there's a number of families who have been with children, and, obviously we work on, getting GEDs, job skills, vocational training, etc. We do find that some of that population probably should be receiving some form of Social Security disability, whether it's SSI or SSD. So we do have an examiner whose job is, while people are, years going by, 2 years, 3 years, the examiners make that referral to the examiner to then look at, okay, what are the barriers? What, are there medical conditions? Are there handicapping conditions here that are preventing the individuals from getting employment?
So it sounds like, you know, you are increasing monitoring and looking at all those issues there. So you can kind of give us a report again on, you know, how that's working out. Okay, are there any questions about safety net?
I won't ask them now.
Okay, and quickly, the DFS vendor verification. We were looking at, in discussions about, you know, multiple vendors through the department and whether they're actually being monitored, so increase, I know, I believe it was in Ulster or Orange County, they started to do home visits, which, you know, we had talked about that, lack of staffing, you know, would be a hindrance to that. But, possibly, you know, monthly phone call to monitor what these vendors are actually, you know, if they actually have people in their homes or.
And well, right now, if you look at the number of vendors, I think it is 10,640 vendors that DFS has. Now, I don't have a number of how many of those vendors are inactive, but what we're in the process of doing is establishing a policy that is more along the lines of a vendor application process. So, I mean, what happens now, and your vendors are created many times in your temporary assistance cases with landlords. And there's a shelter form, and the landlord provides a shelter form. The shelter form comes into the examiner sends it to data entry, and you have a vendor created. What we've done in the last 3 weeks is to put the requirement that management has to authorize the vendor. That it will still continue to go through the process that it has, but management staff will have to approve the vendor before they're created. And then what we are also, and we need legal assistance in creating an application for vendors that want to receive payment from the department. And it will have, you know, DBA information, doing business as information. It will have, what other, Jerry, things are we looking at?
Pedigree information, just something where we can contact people whenever we need to contact them.
And what
find
about
out.
those who are out of state?
Same thing.
I mean, do they get a separate form being out of state?
Well, we're gonna come up with an application, and again, we need assistance, and because we've discovered very recently the vendor creation, issue and the need for different kind of oversight.
So how was that being, overseen before? Because you're instituting a requirement that management will approve the vendors.
Right.
Who was approving them before?
It was really at a individual examiner level basis, based on the submission of, using landlords as an example of a shelter form. And then in the past, with the shelter, before we paid shelter in the past, we had a housing inspector who would go to the residents and determine if the, condition of the housing. When that position was eliminated several years ago, they discontinued that practice.
So at that point, when they had a housing inspector, do you have, an idea of what the numbers were back then? Because with over 10,000 vendors, are these are out of county as well as in county?
That's why I've said if the wish is to have me verify all these vendors, I need 20 staff, and that's just to do that.
Sorry.
Right.
Can we
So
determine?
we have to have other systems, and I think the application process and the annual, update to us about any changes in the vendor will be a good start.
So is there any way to determine which ones are active? You said you
Yeah,
weren't sure.
yeah.
So out of the 10,000, are they all active, or you don't know that?
No, they're not all active, no.
Okay.
I mean, we just need that 25th hour in the day.
How do I?
Okay, any questions? Okay, let's move on to the resolutions. Number one, to establish a policy
I'll move
relating
it for
to
discussion.
the discharge of parolees into Sullivan County.
I just have a question for Randy. I sit on the Federation of the Homeless Board. I know often people go over there thinking we have a shelter and they don't, and we have to turn them away, we send them to you, okay? You have the resolution in front of you? Okay, the number C. You just take a look at C, and just wondering how you're going to, on one page, it says, under the, it says, avoid the release of persons who require temporary housing from being released into Sullivan County on an evening, and particularly a Friday evening after the close of business. How are you gonna handle that?
We had a meeting with Department of
Yeah,
Parole.
maybe I could I'll update real quick. We had a meeting with the Department of Parole. We had 3 representatives from the department. We had all law enforcement here from village police, we had the DA represented, we had the sheriff, and we discussed, in 2011, it was 90 parolees that entered Sullivan County, and this year it was 67, I believe, right, 67? So in conversation at the table with, the representatives from parole, they had basically, determined that the 67 were, all residents of Sullivan County, and that, they were released here because Sullivan County was the point of entry. When we, had the discussion, and there were all these issues laid on the table about the evening releases, on Friday evenings, after 5 o'clock, that was an issue with, some of the law enforcement. At the end of the meeting, the conclusion and the recommendation was to review the parolees that are entering here. For some of them are coming through Medicaid shelters that, prior to that, had an address somewhere else. So we were talking with the commissioner, and he said that he would work with us. I had a subsequent conversation with them, and they're more than willing to work with us to try to reduce the numbers. And some of the explanation for the evening hours was because they were coming from western ends of the county. By the time they got processed and moved down into Sullivan County, transported down here, but some were not. So I think it would be those that would
I mean,
be
it's
So
pretty-
they're gonna
addressed.
guarantee us they're not gonna drive anybody here on
No.
Friday? Oh, okay.
No,
that's-
they're not.
Well,
okay,
there's
that's-
exceptions.
And I asked them,
Right.
okay, so can you just get them here between 8 and 5?
They can't.
So that
They can't always do that.
they can't, if
Not
they're,
always.
if they're taking a bus from Buffalo or.
Right.
But there is kind of an undercurrent, of just wait until after 5.
What
And,
if-
and show up at Liberty PD, or, I mean, there was a heavy number
Well, that's a
showing
problem
up
for
at
us,
Liberty PD. homeless.
representing
Well, how-
District 6, because, when you start going through all of the discharge papers, which, several legislators have come with me and sat at the police officer's desk, you have them writing in, everything is typed in their discharge form, but what's handwritten in is 10 Community Lane or 16 Community
16.
Lane. And A, we know that's not a residence, and B, we know that it's not open past 4:30. So, the police department ends up acting as a temporary housing unit. And generally, even if they came from other parts of the county or other parts of the state or other parts of the country, they've been funneled in through Liberty, and that's where they remain. That's an issue.
Right,
that-
so what we can do now is parole gives us notification of their date of release. So if we know the date someone's coming in, if by 5 o'clock, we're anticipating that person to come in and they don't make it, we can then notify the sheriff's department and area law enforcement that this person will be arriving in the county, after business hours. And we actually also have a TA worker who is on call for homeless individuals, so I think we can get more active.
And then there's the other side of what you're doing, which is to really ask people, are you really homeless? Is there someone that you can stay with?
But on the
And-
parolees, what in our meeting with parole, and I think it's addressed partially in the resolution, is that we have talked with parole officials about, getting us information earlier. Most of the time, they know the release date, get us the information earlier, and get them set up with CWD from day one. If they can find housing earlier, if they can give us an application earlier, that's better. There were, sometimes they need mental health, substance abuse counseling, if they can get an appointment pre-scheduled with community services. And they identified a couple barriers and, you know, with Medicaid being active, et cetera. But I think we have a good start because we have larger counties, they told us have, I can't remember what were the teams that they have, discharge teams.
Task
They-
force committee,
They have
yeah.
a committee that meets about each parolee, but they're counties with hundreds and hundreds of parolees being.
Are they state workers or county workers?
No, it's just the local,
Within the county.
within the county.
The reason,
Huh.
the problem on the Friday night issue came, they can't release them early, and they can't keep them one day late.
Right.
They've gotta be released on a particular date, based
Right.
on their good time
And a
in
particular
the
time as
facility.
well.
So if they're being released from someplace like Buffalo or up along the Canadian border, then you've got the travel time. But being able to give the commissioner a better heads up as to when they are going to be released. And the thing that was really a problem, we never had a heads up as to what the needs were gonna be. And getting a heads up as to what services and needs are gonna have to be met. So appointments can be set up in advance and things of that sort is gonna be a very big help to the commissioner. And they seemed receptive to doing that, didn't they?
They were very cooperative.
It was a good meeting, and
It
they were
really
open
was.
to working with us.
It was.
Okay, are there any other questions before I call the question? Okay, all in favor? Any opposed? Okay. Okay, resolution number 2, to authorize a contract with Rehab Support Services.
Correct. This is actually the culmination
Gotta
of a
wait for a
couple of
motion.
years'
Oh,
worth.
motion to discuss. Second? I'll second. Okay, sorry, John.
Just saying this is a culmination of about 2 years' worth of work where
Mhm.
we are going to contract with RSS to actually, have our employees work in their personal recovery-oriented services program. On the same day that those employees go over there, the day before that, we'll be closing our day treatment program that we operate in the Community Services Building. That space will be procured by, I believe, the Department of Family Services once our folks are gone. We've gone through our insurance department. There's a brief memo attached to the resolution explaining exactly what this contract will do. RSS basically will be paying us for the use of our employees.
Okay, and this has been an ongoing discussion
I
about.
said
the
RSS
transition.
will basically be paying us for the use of our employees.
Reimbursed, right?
And
Reimbursed.
the
Yeah, it's a
reason,
wash.
the reason why you went with RSS as opposed to any other, it was, I can't remember the name of the other group that did
We were
it.
looking at a couple of the other private
Yeah.
non-for-profits. RSS decided that they would want to reimburse us for our employees, so there's no layoff. There's, the union has been participating in, this process throughout. As a matter of fact, the employees who are scheduled to work with RSS have been working with RSS already in terms of, making this transition. So I think, this is actually a good thing for everybody involved.
And that was actually the goal that we had set up, the transition of
Yep.
the workforce,
All right,
right?
well, here's the question. It's a one-year contract, am I correct?
Renewable with a letter.
Okay. My question is, once that contract expires, do we lose any employees?
No.
What if they decide to change the?
The intent of this contract, and it's spelled out in the contract also, is that these employees will remain county employees until they take another position within the county, leave for other employment, or retire.
Regardless
I
of the
understand it was
expiration of the
5, huh?
contract?
The contract will be renewable until those employees are no longer county employees.
What if it's decided that contract isn't renewed?
Well, that would have to be mutually agreed upon.
And that's 5 employees, is that correct?
4 now.
4 now?
I'm sorry, so I'm
don't
an
wanna lose
employee
anybody.
and
wanna put
I'm
anybody out
working
of work.
as a civil servant in the department.
Yep.
next week I start in this other program.
Mhm.
My salary remains the same. All of my benefits remain the same. The county gets paid more money because RSS is taking over a piece
No.
of it.
No,
Everything remains the same.
Gene, take one and pass.
we get reimbursed for the costs of those employees.
Okay.
As a matter of
Okay, let me
fact,
go
those,
one step
those
further.
employees will report to work at the PROS program, but punch in using the county's time and attendance system.
Okay, and for some reason, next year, that program decides that they no longer want to remain as an employer. What happens to that employee?
Those employees would be subject to the provisions within our contract, which would allow bumping of employees, senior employees to other employees who would have less time. So that would be the consequence of that action. For whatever reason, they decide, RSS decide not to have a PROS, RSS decides that they wanna get out of the business, those employees would have the ability to bump back based upon the terms and conditions of their employment.
So they did not lose their status within this?
No,
Okay.
they remain county employees.
That's
Okay.
providing there's a vacancy in the county, right?
No.
No, if they could
have
actually bump
seniority,
another
they can bump
employee,
another
which
employee out of the job.
was what I was getting to.
So where's the center gonna be, the daycare?
The PROS program will be over on Crystal Street here in Monticello.
Okay, any further questions? No. All in favor? Any opposed? Okay, thank you. All right,
Thank you, folks. I really do appreciate all of your support in this process.
thank you.
It shows the difference when something's you take the time to make a transition go smoothly, so.
Okay, number 3, to accept the Rural Minority Health Grant with New York State Department of Health.
Move it.
Second,
Or, you gotta get a break.
discussion.
Sounds good to me.
Okay, all in favor? Any opposed? Okay, and Nancy McGraw had asked that I pass out this resolution, introduced by Health and Family to apply for funding for a county health ratings and roadmap health grant. Do
Move
you
it.
wanna,
For discussion?
describe it? Yes.
Second.
Go ahead,
Thank you.
Nancy.
Yeah.
Basically, this piggybacks on what we've been doing with our community health assessment process. And I was approached by the state health department just a few days ago, asking us to apply for this money. The deadline is the 17th, so it's time sensitive, and that's why I'm bringing it up here.
How much money is it, Nancy?
About 5,000. It's for planning to improve health.
Normally, we don't like to have late, resolutions coming out, but if it's time sensitive, I have no problem with it.
It was one of those that we just
Yeah,
got notified.
that's-
And
No
does
problem.
Art know about it?
Yes.
Is
Yes.
there a county share, a county cost?
No.
Yes, sir?
Okay, consensus to pass it through committee?
Somewhere in that.
Yeah, so move it now. I'd be happy to move it now. Laura?
Okay.
Yep, I'm behind it.
All in favor?
One other question, if I may, before we give a full, if it's passing through committee and it's time sensitive, how does it pass if it didn't pass full board in the time?
It will pass full board, won't it?
Yeah, what's the deadline, Nancy?
Oh, the 17th.
The deadline to apply is the 17th. We won't actually get notified until January if we.
No, we're talking
But
about,
I'm asking.
full board is the
Full
19th.
board is
Right.
after.
The board has a policy that any discretionary grants, we require a resolution. This is just to apply. We're not entering into contracts or committing yourself to anything. So if it's the pleasure of the board and you vote through here, we can just pass it knowing it'll pass the full board. Because you're not committing, you're just applying for a grant.
as long as Art didn't have any,
No, he was,
objections.
he was
Oh,
in-
Well, informed is different than having supported.
no, I mean, it was one of the, it's almost like your
You
public
got
safety
that?
stuff like Dick's
Okay.
Cotton, where you have a
Okay.
week to apply type of thing. It's kind of what we were.
Okay.
Okay,
Thanks for the
public
clarification.
comment time. Any public comment?
We didn't pass it.
Oh, I'm sorry.
Took that.
All in
All in
favor? I
favor?
saw hands go up, and
Yes.
it looked like no one was opposed. Thank you.
Thank you.
Public comment. Okay, motion to
So
adjourn?
move.
Second. We're back in 20 minutes.
15, well, 18
18 minutes.